Vaccines for kids ages 5 through 11 is a landmark moment in our vaccination campaign. The first mother to get her child vaccinated last night captured it well. It's a sigh of relief. 28 million young kids are now eligible for vaccination. We've been planning for this moment, and we are prepared. And beginning the week of November 8th, our program will be fully up and running with about 20,000 trusted providers and convenient sites across the country offering vaccinations for kids ages 5 through 11.
Today is truly a monumental day in the course of this pandemic, and one that many of us have been eager to see. Nearly 12 months have passed since the initial recommendation of COVID-19 vaccination for those 16 years and older. And since that day, many of us have been asking, when will we be able to expand this protection to our younger children? Yesterday's CDC Advisory Committee on Immunization Practices met to review the latest data from Pfizer on the safety and efficacy of COVID-19 vaccination in children 5 to 11. The committee also discussed in detail the clinical need for vaccination in these younger children. Throughout the day, I listened intently to the committee's open, transparent, and robust discussion. Following their unanimous vote, I endorse their strong recommendation that children 5 to 11 years old should be vaccinated with the Pfizer pediatric COVID-19 vaccine. With this vote, we are now expanding vaccine recommendations to more than 28 million children in the United States. Distribution of pediatric vaccinations across the country started this week, with plans to scale up to full capacity starting the week of November 8th. I want to speak directly to parents about this recommendation. We have followed the scientific process. We have done our due diligence. Please know we have thoroughly reviewed all of the available safety, immunogenicity, and efficacy data before recommending this vaccine for your child. In clinical trials, vaccination was found to be nearly 91% effective in preventing COVID-19 among children ages 5 to 11. In clinical trials, vaccine side effects were mild, self-limiting, and similar to those seen in adults with other vaccines recommended for children. The most common side effect was a sore arm. The safety of our children is of utmost importance to me, and I believe these vaccines will help us to better protect our children from COVID-19. Throughout this pandemic, we have learned a tremendous amount about both COVID-19 disease and the way it affects our children, with nearly 2 million reported cases of COVID-19 in children 5 to 11 since the start of this pandemic. These cases have ranged from mild to severe, with some cases resulting in hospitalizations, deaths, multi-system inflammatory syndrome, or MIS-C, and other long-term complications.
Let's take a look at the cumulative burden of all children, those less than 18 years old. Over 5 million cases, over 65,000 hospitalization, and as the total group, over 5,000 multi-system inflammatory syndrome, with total deaths, as mentioned by Dr. Walensky, of now approaching 800 individuals. Next slide. Let's take a look specifically at the group under discussion today of the 5 to 11-year-olds. 1.9 million cases reported, more than 8,000 hospitalizations, 1/3 of which resulted in a requirement for an ICU admission. Among that younger group, more than 2,000 multi-system inflammatory syndrome, and in the total cohort, at least 94 COVID-associated deaths. Next slide. Let's take a look at the underlying medical conditions among children of that age group who are hospitalized. As you can see, it's dominated by chronic lung disease, obesity, and neurological disorders, but there are a number of other disorders, many of which we see frequently in children, particularly children of a certain age, that make it very, very likely that an individual, if they do become hospitalized, will have one of these underlying conditions. Next slide. What about the post-COVID conditions? I've already mentioned, as has Dr. Walensky, the multi-system inflammatory syndrome, but there's also ongoing or residual symptoms and complications reported in children referred to as long COVID, which occurs in children maybe to a lesser extent, about 4 to 6%, but nonetheless, long COVID does occur in children. Next slide. Let's take a look now at the incident rate. Children and adults are equally vulnerable to coronavirus infection. There was some consideration earlier on that that was not the case. That may be because children are less likely to become sick. And in this JAMA Pediatrics paper, it was shown that 50% of children 5 to 11 years are without symptoms. So we should not underestimate the incidence in children. Next slide. What about transmission? Transmission, secondary children transmission does occur, both in the household and in the school settings. And vaccination, we hope, will decrease this transmission. Next slide. What about the efficacy? In individuals 12 to 15 years old, this study just a few months ago showed that in adolescents of those age, the vaccine efficacy is extremely high, approaching 100%. Next slide. And in a very recent study that Dr. Walensky measured, when you look at children within the age group under discussion today, 5-11-year-olds, about 91% efficacy during a period of time when Delta was the prevalent strain. I've shown you disease burden, incidence, transmission, and the efficacy of the vaccine. Every reason in the world to get our children vaccinated.